Hello everyone, I'm Alan Patlán and I will be presenting the findings of our systematic review of the effects of water, sanitation, and hygiene on the prevention and treatment of childhood acute malnutrition. This systematic review was performed as one of the steps of the ACF Francis F. Fract initiative, which aims to summarize robust scientific evidence to guide actors on the field. Even though WASH could play an important role in undernutrition prevention and treatment, most of the current evidence of WASH effects on health focuses on diarrhea and other infectious diseases, while the scarce literature of WASH effects on undernutrition is mostly focused on stunting, despite acute malnutrition entails more serious consequences for children's health. The aim of our systematic review was to robustly assess the effects of WASH conditions and interventions in preventing and treating childhood acute malnutrition, and to summarize the available scientific evidence to guide future research and support policy and operational guidelines. In consequence, our research question was: what is the effect of water, sanitation, and hygiene on acute malnutrition? The main source of articles for this systematic review was PubMed. However, reference lists of previous relevant systematic reviews were also screened to identify literature possibly missed in the primary search. What is also important is that the systematic search strategy was built with researchers and technical and operational experts in the fields of WASH and nutrition to include a combination of relevant terms for both sectors, characterizing the impact of widely used WASH indicators and interventions on child acute malnutrition. In this review, acute malnutrition is inclusive of both severe acute malnutrition and moderate acute malnutrition, and is defined as weight for high Z-score under -2 standard deviations or a mid-upper arm circumference of less than 12.5 centimeters and or the presence of bilateral pitting edema. Only studies that use definitions of acute malnutrition by anthropometric measurements based upon the National Center for Health Statistics Child Growth References, the World Health Organization Child Growth Standards, and or mid-upper arm circumference were included in this review. Now let's move to PICO. Population of interest were children under 5 years old in low and middle income countries. Targeted interventions were WASH interventions or at least one WASH-related component or condition. In the types of studies that included a control group, the groups were comparable in all respects, including WASH interventions or factors. The primary outcomes of interest were the prevention or treatment of childhood acute malnutrition and were assessed through the next indicators: severe acute malnutrition rates, moderate acute malnutrition rates, global acute malnutrition rates, weight for high Z-score, and mid-upper arm circumference. Criteria for the inclusion of the studies were the study design, articles written in English and published between January 1st, 2000 and May 13, 2019. The aim in restricting the dates of inclusion of articles was to include only recent studies providing evidence on currently implemented interventions, which could robustly guide programmatic actions. Systematic reviews and meta-analysis were excluded. A total of 599 articles matching the search terms were identified through the primary search and the screening of reference lists. After duplicate exclusion and the abstract and full text assessment, only 26 articles matching the eligibility criteria were identified and therefore included in this review. Studies were assessed following the GRADE guidelines for rating the quality of evidence, and the significance of evidence was adjusted accordingly. The overall body of evidence relating to the associations of each WASH condition or intervention with acute malnutrition was assessed based on the EPC approach for grading the strengths of evidence. We also performed an additional evaluation of non-intervention studies according to the Newcastle-Ottawa scale. Now let's move on to the results. If we look at the distribution of articles published per year, we can see that it is only in recent years that studies assessing the effects of WASH on acute malnutrition have increased significantly. From our review, 43,083 participants composed the entire sample size of the 26 included studies, with studies ranging from 88 to 80,246 participants. All studies were performed in low and middle income countries according to the World Bank categories: 12 in Asia, 11 in Africa, 2 in America, and 1 was multi-country. Regarding the context, 10 were performed in urban settings and 19 more in a rural context. Among the included studies, 8 were CRCTs, 1 was RCT, 7 more were case control studies, 5 were prospective cohorts, 1 was cross-sectional cohort, 2 quasi-experimental studies, 1 retrospective observational study, and 1 panel data secondary analysis. After assessment of the studies, 11 studies were rated as high-quality studies, 2 as moderate quality, and 13 as low quality according to grade guidelines. Evidence of the associations between WASH conditions and acute malnutrition was more frequent, while very limited evidence was found on the effect of WASH interventions on acute malnutrition. Consistent findings of strong associations between WASH and acute malnutrition were not found. Most studies found no effect of WASH interventions on the primary prevention of acute malnutrition. In some studies, an effect of WASH interventions on improving severe acute malnutrition treatment outcomes was found. These interventions included improving household water quality, providing water treatment services, and providing a WASH service package. However, pathways of the effects of WASH on acute malnutrition remain unclear. Available evidence suggests that combined WASH interventions have a greater effect on growth outcomes when compared with single interventions. The results linking water treatment with the prevention of severe acute malnutrition and improved recovery rates during severe acute malnutrition treatments are consistent with the results of other systematic reviews. Nevertheless, there is a need for more robust intervention studies to consolidate evidence on both the single and combined effects of WASH interventions on childhood acute undernutrition and the applicability of WASH interventions to synergize the positive effects of nutritional and other programmatic interventions. Strengths of this systematic review include that, to our knowledge, it is the first systematic review focusing on the associations of WASH conditions and the interventions with the prevention and treatment of childhood acute malnutrition. The search strategy was standardized and used rigorous eligibility criteria for study selection. Inclusion of WASH and nutrition field actors in developing the search strategy, allowing to use operational relevant WASH conditions and nutrition indicators. As for the limitations, compliance and uptake of the interventions were not reported in most studies. Therefore, we could not evaluate the effects of those parameters on the efficacy of interventions. Furthermore, many of the interventions in trials consisted in packages of WASH-related services, making it impossible to define the effects of each individual component. In conclusion, the points to highlight are that the evidence base is mixed, with studies generally from low quality and high risk of bias. Only few studies have assessed the effect of community WASH level conditions and interventions in acute childhood malnutrition. Current evidence on the effectiveness of WASH interventions on both the prevention and treatment of acute malnutrition does not show consistent protective associations. Only improved water quality during outpatient treatment for severe acute malnutrition show an effect on improving recovery outcomes as assessed in two high-quality studies. However, prevention of relapse post-discharge was not demonstrated. Finally, future directions on this topic should include higher quality and adequately powered intervention studies, which are needed to assess the effects of different WASH interventions on the prevention and treatment of childhood acute malnutrition. Further research assessing the effect of community-led WASH interventions compared to household-level interventions is also needed. Such studies will help us to draw conclusions on the effects of single or combined WASH interventions on acute childhood malnutrition, to better clarify which WASH interventions are most effective in improving acute malnutrition outcomes, as well as to prove which causal pathways are the most significant contributors in acute malnutrition. Thank you very much for your attention.